In a surprisingly bold move, given the way his previous budget was excoriated by both Republicans and Democrats, Congressman Paul Ryan unveiled a new budget blueprint this morning. Unfortunately, for large numbers of Americans, it calls for a massive overhaul of Medicare, the slashing of Medicaid, food stamps, old grants, and a host of other important programs. And as for the political gamble of introducing a budget during his own party's fight for the Republican nomination, well, Mr. Ryan, responding to a question from our own Luke Russert, made it clear that he expects the nominee to follow his lead.
Whoever our nominee is going to be owes the country that choice of two futures. We're helping them put this together. And each of these people running for president have all given their various ideas and reforms with perfectly jive or consistent with what we're proposing.
And you wholeheartedly believe they will accept your budget
Absolutely.
in November?
Congressman Peter Welch is a Democrat from Vermont and Chief Deputy Whip, and he joins us now. Good afternoon, sir.
Good afternoon, Martin.
Mr. Ryan proposes reducing tax rates from 35% to 25% and a lower rate of 10%, and also removing the alternative minimum tax rate. But how does he balance the budget without raising any new revenues? Can you explain that to me?
Well, it's a bold plan. The question is, will it work? My view, no, it's designed to fail. There's two assumptions in the Ryan budget. Number one, austerity leads to prosperity. The cuts is where he's going to pay for the tax cuts.
I would advise him to have a look at Europe, because there's the evidence.
Well, that's exactly right. So his budget is austerity in education, austerity in basic scientific research, austerity in roads and bridges, and rolling out broadband. That's not a prescription for growth. The second assumption in the Ryan budget is doubling down on this notion that when you have a big debt, the way to deal with it is by cutting taxes on the people who are in the best position to help us pay the debt. So those two assumptions, austerity will lead to prosperity and tax cuts for the well-off are going to generate growth. There's no evidence to support either of those propositions, and as you mentioned, enormous evidence to indicate that those are dead-end approaches.
This plan also includes a controversial approach to changing Medicare. For those under 55, as you know, it moves from the traditional fee-for-service structure in which the government pays doctors to a voucher system with government subsidies for buying health insurance. Will that work? And why isn't that considered, quote, a government-run healthcare program?
Well, good point. But once again, this is where there's a claim that it's bold, but really it's a cop-out. And I'll tell you why.
You keep using the word bold. I'm getting the impression it's bogus. That's the word.
Well, it's bogus and bold. You know, you can have both. It's bold in the sense that it's a big number, it's a big cut, it's a doubling down on austerity, it's more tax cuts for the very wealthy. In that sense, it ends up by shifting the burden onto the middle class, widening the income gap, enriching the people who are doing very well. So it's not a timid proposal. Let's acknowledge that. But it is a prescription for decline and for increasing economic inequality. On health care, for instance, he wants to have a, quote, bold proposal on Medicare, but all it does in the name of boldness is shift the cost onto Medicare recipients. It doesn't reform how we deliver health care, which is absolutely essential, not only for Medicare, but for the entire health care system. What he should be talking about is moving away from the fee-for-service, volume-driven system where we pay in this country the highest rates for health care and get the least back for it. That would be real reform, as opposed to simply burden shifting onto folks who are trying to pay the ever-rising health care premiums.
Maybe he'll come up with that notion in his third version of this budget. Congressman Peter Welch from Vermont, thank you very much.
Thank you.
We'll be right back.